Laboratories in India, unfortunately, if you see, are focused predominantly in larger towns or big towns, especially the laboratories which are high-end and are able to give you investigations, reports relatively quickly. With that referral kind of a system, the sample will need to travel long distances, and many a times sample integrities are also a question mark. So if we look at the breadth and the width of our country, we have a huge population base to cater to, and at the same time we also have a huge area to cover. A lot of our population also lives in tier 2 and tier 3 cities and towns, and even in villages. For us to have a referral laboratory in every small town and village is practically not possible. So therefore, having point of care strategy would be the best, because you will be able to provide a test nearest to the patient, and at the same time you will be able to get the information quickly, because point of care testing is what gives you a result rapidly, and you can act on that quickly and probably even transfer the patient to the right center. So therefore, strategically, if you see, point of care testing in a country like India and developing nations has a huge role to play. When we do point of care testing, a lot of testing which is done may not be interpretable directly by the patient himself. Sometimes even the interpretations can become a major challenge, and that's where the big role of a point of care coordinator comes in. The point of care coordinator eventually is going to help you to bridge that gap between what is being performed at the point of care and the expertise to interpret that particular point of care testing for you to give the right results to the patient. There are a few solutions which I have been able to see of late, where this point of care device which you were using at the patient site, you connected it to something which was central, and the interpretation actually came from a subject matter expert elsewhere in the country. So this is where a very coordinated effort from the point of care coordinator comes in, and that's what the major role of the POC person will be.